Mr. Sanders is 82-year-old man, and he has developed an exacerbation of COPD. That's why we're going to start a oxygen therapy on him through a nasal probe, because his saturation has dropped down to 86%. So I'm just going to show how to do the oxygen therapy with a nasal probe. These are the nasal probes.
You have to make sure that it fits well and that this one is on the nose.
Okay, I'm just going to put it through.
And if there's like a nail,
3
like a
liters
little strip here, you can pinch it to make
and then
it
check
up.
whether the oxygen is coming or not. And it's coming,
If
so I'm
it
just going to
doesn't
put it
fit
on
well,
his
you
nose
can
like
tighten
that.
it, but you can't tighten it too much that it will impede the venous blood flow.
And make sure it doesn't get on his neck. And that's how we do the nasal prong of oxygen therapy. And we can also use the Venturi mask for oxygen therapy if you need more oxygen. So, and I'm also going to do the peak flow meter test on it. And this is a peak flow meter, and this is the filter. And we can use one filter for one person only, because it can't be used with other people. Only one for one person. For infection control. And so I'll demonstrate how to do a peak flow test. First, we have to pull this red mark down at the end of this meter like that, and then we have to connect the filter with the peak flow meter, and then we have to take a long deep breath in and then breathe out, blow the peak flow meter as fast as we can so that it will get the reading over here, and we'll do it 3 times, and then which we will take as a reading. So I'm gonna show how to do it, and we have to make sure we put our mouth around it nicely.
So that it helps with his.
And that's how we get the reading. So we continue that for 3 times, and then the highest one will be counted as the peak flow reading. The peak flow meter reading, and among the 3 of the readings, I've taken the highest one as my reading, and then already charted on a peak flow chart. So our patient, Mr. Sanders, is in a PRN nebulization, so I'm just going to show I'm just going to demonstrate the process for that. So for nebulization, we don't need to have a sterile technique for hand hygiene. We just need to maintain a septic one, so we can just use the antibacterial hand gel. And for the nebulization therapy, we need a special nebulization mask. This is the mask which we use for nebulization. And this is the nebulizer jar, and this is the nebulizer lid, and we have the supply tubing and the prescribed medicines. So now I'm going to show you how to do the nebulization therapy. So first of all, I've already done my hand hygiene. I've already performed my hand hygiene here. So first of all, we need to, in the nebulization jar, we need to put our, before giving the nebulization nebulizer, I'm just going to check Mr. Sanders' medication chart to make sure it's charted on his medication chart, and it's on the PRN medication. So we'll go through the 6 rights and the 3 checks. So I've already checked it, and it's prescribed for him, so I'll show you how to do the
and when you approach him, you'll have to do the 6 rights.
Okay. And first of all, we're just going to get this
you have
medicine.
to put it in through the top,
and then put it in the nebulizer jar, nebulizer jar.
and you'll have to screw it on this one.
I'm just going to nebulizer jar, and I'm just going to put the lid on the top like that, and connect the mask with the nebulization jar.
We also have to make sure that he's in the right position and
is the
preferably
connecting
high
tubing.
phallus,
And I'm just
so
going to
that
put the
he can
tubing,
breathe better
one
when
end of the
we are
tubing to
administering
the
the nebulizer.
lead,
So now I'm going to
and
put
the
on-
other to the air supply now. So,
So
we
before
need
you
to
put
make
it
sure
on,
the air supply is
again, you have to
air supply
reassure him
about
that
5
there's
to
nothing wrong.
6 liters per minute, and then the patient is sitting upright. And before giving the nebulizer to them, we need to tell them during the nebulization they need to breathe in and out so that the medicine will work properly. So I'm just gonna turn it on
So
now,
nasal promise, before you
just
go
to check
the
whether
patient,
it's
you'll have
working
to
or not.
re-educate him as well, and that it's okay because it's just a strip.
So I've got it on 6 and it's working, so I'm just putting it on the patient's nose
And
like that.
you'll have to check that there's oxygen.
To make sure it's on their nose properly. And we just make the patient comfortable while they have nebulization on for him. And we just need to come back and keep checking on them till the medicine is finished. We can see the steam coming out. So I'm just going to stop it now because it's finished. You just have to turn it down.
And because Jeff, he has
And then take it off.
he has sputum inside,
Carefully.
he needs to cough it back up. So the first thing,
Okay, I've disconnected the nebulizer now. So I'll just make sure the patient is calm, because sometime after the nebulization, the patient might have some residues or steam around their nose and mouth. So I'm just going to wipe it with a tissue and then give them a tissue or a bowl to spit if there's any cough or any sputum or things they have. So and with the nebulizer mask and the tubes, like some hospitals, they use the same nebulization mask and the tubing till they are there, until they are discharged. Like they just wipe it with the antiseptic wipes like that, and then hang it next to the patient's bedside to use it for the next time. Or in some hospitals, they just they also soak it in the antiseptic solution to soak it in the antiseptic solution and then dry it and use it for the next time. Mr. Sanders had the exacerbation of COPD. After the nebulization, we will encourage him to have oral fluids, and we'll also encourage him to be sitting on the high phallus position, and also we'll encourage him to do the deep breathing and coughing exercises and the pursed lip breathing exercises.